What your financial advisor doesn't know about Medicare could actually hurt you. Financial advisors are so knowledgeable about accumulating your assets. They're great at making you money, especially while you're working. You're investing, they're earning more for you. They do a great job. And then there are some advisors who specialize in maybe estate planning or retirement planning. So they're more concerned about how you use your investments now that you've saved them up all these years, or how you pass them along to your heirs maybe. But even the best estate planners and retirement advisors don't really know that much about Medicare. It's important to have a Medicare specialist advising you along with your regular retirement advisor. So although I am a registered investment advisor myself, I specialize in Medicare and long-term care planning. And I really did that for a couple of reasons. Part of it is because people had more questions about Medicare than they did about their 401ks. They knew they had to roll it over, you do whatever you have to do, but they had a ton of questions about Medicare. And the second reason is that I've seen firsthand how having maybe not the best plan in place, or choosing the wrong plan, quite frankly, has really had an impact on people's retirement. And I didn't want that to happen to other people. So I specialize in Medicare and long-term care planning. So let me give you a few examples of things that financial planners maybe should have known but didn't. So I'm a resource for several different CPAs and financial advisors. And I recently had a CPA call me. She's new to me. And she called and wanted to know why her client's Medicare Part B was suddenly more than $500 a month. Last year it was less than $200. Why was there such an increase? And her client has been retired for several years, so his income hadn't changed, his Social Security didn't change, so why would his Medicare costs change? So we started talking, and we looked at his income 2 years ago. Now his income 2 years ago had been significantly higher because he wanted to help his granddaughter pay for college. And so they had cashed out lots of stocks in order to help pay for that. Well, anytime you cash stocks out, or you cash out any kind of mutual funds or investments, it's counted as income. Your Medicare Part B costs are based on your income. Now, the CPA didn't know this. The client certainly didn't know this. And unfortunately, in this case, the financial advisor didn't know it either, or at least didn't talk to the client about it. So now, for an entire year, that client is going to pay more than double, almost triple, what he had paid for his Medicare in the past. Now, when you're living on a fixed income, that could be significant. The other time that I see this as a problem or an issue is when financial advisors recommend that you move your IRAs into Roth accounts. Now, there's nothing wrong with that on the surface, but what you have to keep in mind is that all of that money that you're moving into Roths, again, is counted as income. And so it will impact your Part B costs. By the way, this adjustment that we've been talking about is called IRMAA. It's your income-related Medicare monthly adjustment. And it is reevaluated every year in January, and it's based on your income taxes from 2 years prior. Now, sometimes you can appeal your IRMAA adjustment. For example, if you were working and you're retired, obviously you're making less now than you were, and you can appeal that. But if you're just selling off property, stocks, something to move into your Roth account, that is not something that you can appeal, and you are stuck with that higher IRMAA cost for an entire year. Also remember that during retirement, you are trying to live on a fixed income. So it's really important for your financial advisor to know not only what your Part B costs are going to be, but also what the difference is if you choose a Medicare Supplement versus a Medicare Advantage plan. Your costs are very different in those cases. And you also have to think about dental coverage. You know, for some, Medicare doesn't cover dental. As we get older, everybody needs more dental services, implants, crowns, that sort of thing. So you have to factor that into your retirement. The other thing that has to be factored in is any kind of home health care or skilled nursing rehab costs. I mean, the fact just is, as we get older, most of us will need some sort of home care or nursing home care. And if you don't have that right plan in place, it really will take a huge cut out of your retirement assets. You already know it's important to work with a financial advisor. It is equally as important to work with someone who specializes in Medicare and long-term care. If you'd like to get more information, please contact our office. We're happy to help, and all of our consultations and advice is free. There is no cost, no obligation.